Breakthrough in pancreatic cancer. Alpha radiation therapy achieves total local control.
A glimmer of hope appears on the horizon for those facing one of the most aggressive diseases, pancreatic cancer.
Recently, the Israeli company Alpha Tau Medical announced impressive results from its innovative therapy, Alpha DaRT, during Digestive Disease Week 2026, the leading international gastroenterology congress. The data, presented in an oral session for the first time at an event of this magnitude, show that the therapy achieved 100% control of local disease in patients with pancreatic ductal adenocarcinoma, the most common and resistant type of this form of cancer. Imagine a treatment that attacks the tumor directly from within, using alpha radiation particles, the same ones that, on a small scale, destroy cancer cells with millimeter precision, without significantly harming the surrounding healthy tissues. That's exactly what Alpha DaRT does. Radium-224 sources are inserted into the tumor via endoscopic ultrasound, a procedure that gastroenterologists already routinely perform for diagnosis and other treatments. The released alpha particles travel only a short distance, concentrating their destructive force on the cancer and sparing nearby vital structures such as the intestine, stomach, and liver. Unlike other external radiotherapy methods, which are often limited by the pancreas's complicated anatomy, this internal approach bypasses the body's natural obstacles.
The studies that yielded these results were conducted at Hadassah Medical Center in Jerusalem and compiled data from 2 initial human trials. 26 patients participated, of whom 19 were evaluated for response. All had advanced pancreatic cancer, some with localized tumors impossible to remove surgically, others with metastases. Many had failed up to 4 lines of chemotherapy or simply could not receive standard treatment due to their health status. Even so, local control was complete. 15 patients, 79%, had their disease stabilized and 21%, showed partial tumor reduction, according to the modified RECIST version 1.1 criteria. This means that the primary tumor stopped growing or decreased locally. Regardless of whether the cancer had spread to other organs, what makes this result even more relevant is the impact on quality of life. In pancreatic cancer, even when the disease is metastatic, the primary tumor often causes intense pain, biliary obstruction, digestive problems, and bleeding. Controlling this local focus can significantly alleviate daily suffering, even if the treatment does not cure the disease as a whole. Dr. Philip Blumenfeld, director of the Advanced Radiation Therapy Unit at Hadassah and responsible for the presentation, highlighted that the therapy fills an important gap. While stereotactic body radiotherapy, SBRT, faces limitations due to the proximity of critical organs, Alpha DaRT delivers radiation exactly where it is needed, with a favorable safety profile.
Regarding safety, the numbers are also reassuring. Of the 26 patients treated, only 27%, experienced adverse events related to the device, 8 in total, and almost all resolved within 2 weeks. There was only 1 case of persistent fatigue. For patients already weakened by the disease and previous treatments, this low impact is a major advantage. Dr. Robert Den, medical director of Alpha Tau, emphasized that the consistency of the results in such a heterogeneous and challenging group reinforces the therapy's potential for advancement in larger studies. The technology is not new in concept, but its practical application represents a leap forward. Developed from research at Tel Aviv University, Alpha DaRT was created to be integrated into the normal flow of oncology care. It does not require specialized rooms or new infrastructure. The procedure takes place in the endoscopy room that patients already use. This facilitates adoption by multidisciplinary teams and paves the way for combining local radiation with systemic chemotherapy without excessively increasing overall toxicity. These data from Jerusalem serve as a solid foundation for the IMPACT trial, which is underway in the United States and now includes more patients and combinations with chemotherapeutic agents such as gemcitabine and nab-paclitaxel. The goal is to confirm whether the therapy can be used routinely, not only in advanced cases, but also to improve outcomes in newly diagnosed patients. Although still investigational and without commercial approval in the United States, the initial results spark optimism in an area where progress has been slow. Pancreatic cancer remains one of the deadliest, with few treatments that truly change the course of the disease for most patients.
Experts like CEO Uzi Sofer see this as a paradigm shift, an intratumoral option that complements existing treatments, respecting the patient's natural path within the healthcare system. For families living with a pancreatic cancer diagnosis, each advance like this represents more than just numbers in a study. It represents time, relief, and perhaps a real chance to live better with the disease. The road ahead is still long. New studies need to confirm these findings on a larger scale and over a longer period. But what was presented in May 2026 at Digestive Disease Week is already making history as a milestone. The first time alpha DART has been highlighted at a major gastroenterology congress with such promising data. It's a reminder that science, when it combines physical precision with humanized medical care, can transform even the most difficult challenges. For those fighting pancreatic cancer, this news arrives as a breath of fresh air and an invitation to hope.